So what are the symptoms? How can we identify that how the low AMH is there? So there are usually no symptoms initially. Unless and until we do the blood test, we can't find out what are the symptoms of the low AMH. So maybe initial symptoms which indicates few things are can be an irregular periods or short menstrual cycles or difficulty in getting pregnant after trying for months, a family history of early menopause or any previous history of ovarian surgery or damage should fetch a clue that the patient is having a low AMH. So can we prevent this? Or can we have any treatment for this? So prevention is little difficult. The main thing is that whenever we go for a fertility check, when we came to know that the woman is having the low AMH, so we can plan for the fertility preservation. Fertility preservation is that when a woman wants to plan her pregnancy, she can plan a pregnancy and baby. Whenever she's not married, she has a career goal, she has a financial stability she wants to postpone her pregnancy and marriage and the childbirth. That time she can do a fertility preservation. She can go to any IVF specialist and she can come to Milann. So where we do a stimulation and we retrieve her eggs and we store her eggs. This is called a social egg freezing. For future, we can use eggs for her pregnancy. And following a healthy lifestyles, like a healthy diet, example, a balanced diet containing of all fruits, vegetable, whole grains, avoiding red meats, oily foods, and maintaining an ideal weight, and walking at least 45 minutes a day, so that her weight is in check and her BMI is maintained between 18 to 25. So healthy lifestyle, like adequate sleep, no stress, following meditation and yoga. So that all this helps to maintain the AMH. That is a healthy lifestyle to maintain the good egg quality. So in this way, she can prevent getting into a low AMH state. So can we treat this? So there is low AMH, it means it's an aging process. We can't reverse the age. For any patient, if there is, sometimes we observe a gray hair, we can color them and make it black, but we can't reverse the age. Like this, AMH can't be reversed. We can't increase the AMH, but at least for some time we can maintain the AMH at the healthy levels. And the main treatment, whenever we find a low AMH, so better plan your pregnancy faster, either by doing a IVF or ovarian stimulation, doing a fertilized egg preservation, or sometimes very low AMH, not able to conceive, then you can go for the donor eggs and the hormonal therapy. So low AMH indicates there is a reduced fertility, but absolutely doesn't mean that they can't conceive. Infertility, we can't say. So whenever we find a low AMH, so early intervention and assisted reproductive techniques improves the outcome. And any patients having a low AMH, if the woman is very young, still we can tie with a natural and IUI for few cycles. When the woman is older, that is about 35 years of age, then it's better we go for the assisted reproductive techniques like IVF and ICSI, so that to increase the chances of the pregnancy. So low AMH, nothing to get panic. So find out, get proper treatment and preserve your fertility. If you're married and ready to have a baby, then go for an early IVF to high success rate. So next, coming to one more important topic, that is endometriosis. So what is endometriosis? It's a condition which usually affects women between 30 to 40 years. And younger women can also have this. In this condition, the endometrium, the lining of the uterus, that is endometrium, which is found outside the uterine cavity. It can be in the fallopian tubes, ovaries, pelvis, or so many other organs, causing bleeding in every menstrual cycle, but this blood can't come out and it collects there and causes a condition called as endometriosis. So the condition is the presence of endometrial tissue outside the uterus causing pain and infertility. So what is the coming to its pathology? It's a chronic inflammation state. Lots of adhesion and fibrosis have been formed. So various theory have been proposed here. So the various theory are retrograde menstruation, genetic predisposition, immune dysfunction, and hormonal imbalance. So it is mainly said that there is a genetic predisposition. For example, if the grandmother has endometriosis, there is a increased chance that the mother and the daughter can get this condition. So it's a familial types of condition. So certain genes are involved in the things, so it causes a familial in conditions. So what are the early endometriosis symptoms? So endometriosis often begins quickly. Many symptoms are mistaken for normal period issues and delaying the diagnosis. The main important thing is a pain. So it is usually starts with the periods, dysmenorrhea, but sometimes people may ignore that, thinking that dysmenorrhea is a normal symptom, and they never go into deep to diagnose for the endometriosis. And the periodic pain affecting daily life, the severe recurring pain that disrupts work, study, exercise, or daily routines is not normal, then we have to consult the doctor. So other type of pain is a pelvic pain outside our periods. Persistent or recurring pelvic pain outside our normal cycle may also be one of the signs for the endometriosis. So sometimes the pain may after the normal coitus, which is not normal. It should not be ignored. Next, when if it spreads to any intestinal things, so the patient may also have a bloating, nausea, constipation, diarrhea, and patient may confuse with the digestive symptoms rather than the endometriosis. And sometimes it may produce as an unusual exhaustion around your cycles, which may affect your mood, focus, and overall well-being. So the important point in recognizing early endometriosis symptoms is very, very important. So coming to the endometriosis, so what are the preventive measures? So endometriosis is a disease which is a progressive disease, which is a hormonal dependent disease. So as the woman goes on progressing with age, so endometriosis also progresses. So certain things which can stop its prevention is maintaining an ideal weight, because as we put on weight, if the BMI increases, there is an obesity. In case of obesity, due to the high fat, there is a lots of hormonal imbalance. There is a high estrogen level in the body. So endometriosis is a condition which is an hyperestrogenic state condition. So in these conditions, the condition may worsen. So my advice is to have an ideal weight and try to change your lifestyles to maintain ideal weight, so that estrogen is under check and the endometriosis symptoms are under check. So how do we treat this? So many medications are there. NSAIDs, hormonal therapy, laparoscopic surgeries. Newer strategies are immunotherapy, gene therapy, stem cell therapy. So many therapies are there. Now, endometriosis is also like we can give about the prebiotics and probiotics for the endometriosis also. So the treatment of endometriosis depends upon the age of the patient. If the patient is very young, not married, then we can treat them symptomatically by giving NSAIDs or hormonal therapy. If the woman is married and not planning for the child, still we can give with the hormonal therapy. Either we can give the combined estrogen-progesterone combination or only progesterone therapies. In case when the woman wants to plan for a pregnancy, then we have to treat accordingly, depending on the stage of endometriosis. So endometriosis has a 4 stages, stage 1, 2, and 3, and 4. So in case of stage 1 and 2, still we can go with the ovulation induction, try naturally or with IUI. Or in case stage 3 and 4, it's better we proceed with IVF, followed by surgery to remove the endometriosis, then plan for the embryo transfer. In case a woman is older age, do not want to plan for the babies, in that condition we can go for the laparoscopic surgeries to remove the endometriosis along with the uterus, fallopian tubes, and the ovaries. So many newer therapies have come, like a hyperthermia treatment, gene therapy, immunotherapy, stem cell treatment, and photodynamic therapy, which helps to control the pain associated with the endometriosis. So in conclusion, endometriosis is a chronic condition affecting the quality of life. Early diagnosis and tailored treatment are the key factor in case of the endometriosis. So whenever you find a woman suffering from the endometriosis, nothing to get worried about this condition. You can meet your gynecologist. You can come to Milann if you're planning for the fertility. So care will be taken that at a proper treatment will be given to you depending on the conditions, and further management will be done. So whenever you see endometriosis, so not to get panic, meet doctor, get treated in a proper way. So we all call it as a endometriosis is a very painful disease. So yes, because of the involvement of the surrounding organs and inflammation, so it is one of the very painful conditions. The women who are suffering from these conditions may know the problem of this. They may require multiple surgeries to clear this. So always for endometriosis, surgery is not the treatment. So newer therapies like probiotic treatment has come into the picture now. So taking probiotics for 3 to 6 months, the symptoms of endometriosis have gone down very properly. And one more point I want to stress here is, so endometriosis, the surgery, whenever you plan for endometriosis, go to the senior doctor, because the clearance of the endometriosis is very, very important. And the recurrence chances are very high because it is a hormonal dependent disease, and high estrogen may cause its effect. So any questions related to this topic, or any important points you want to know about this endometriosis, you are free to ask on this platform here. So not to get panic, take a proper treatment. Now coming to the one more important topic, that is PCOD. What is PCOD? The new definition also has come for PMOS for this PCOD. So it is a polymetabolic ovarian disease. So it is a polycystic ovarian disease characterized with a hormonal imbalance and multiple ovarian cysts. It has three important factors, that is anovulation, androgen excess, and ultrasound features of the PCOD. So why it is coming into picture so much? So why it is coming as a major health risk nowadays? So PCOD is affecting about 80% of the younger women and in a childbearing age. So it is a disease of a young age because of the lifestyle variation and the genetic factors. PCOD has come into the picture. So what lifestyle we are adapting? We are eating lots of carbs, junk foods, lack of exercises, lots of stress, long hours are working. So all this is causing into a sedentary life. This sedentary life causes deposition of fat into your body. So fat is a culprit here, and along with the genetic causes, gene expressions, the PCOD is becoming as a rampant in all over the world, and especially in India, and especially in Southeast India, where we are the rice eaters, especially the carbs eater. Lots of people in South India, we eat idli, dosas, rice, which consist of a high carbs, which is responsible for the PCOD picture. So it has three important factors. One is a hyperandrogenism and insulin resistance and multiple immature follicles in the ovary on ultrasound. Okay, so what causes it? There is a genetic predisposition. As I said, the grandmother to mother, mother to the daughter. Lifestyle factor, which is important factor in case of PCOS. The lack of exercise, lack of workouts causes heavy fat deposition in the body, which is a important cause for the PCOD. So there is two types of fat deposition in the body, the apple type and the pear shape type. So the pear-shaped type of fat deposition is actually good, and apple shape of deposition is a danger for the causing for the PCOS. Next, coming to the insulin resistance. So insulin resistance occurs because of hyperandrogenism and decrease of insulin sensitivity in the peripheral tissue and increase in the weight. And next is a hormonal imbalance. There is an increase in the male hormone or androgen excess here. So if the female starting getting lots of acne, beard, and male pattern of hair distribution. So all these are the important causes for the points for the PCOD. So what is the important step in the prevention of PCOD? Mainly is a weight management. Here weight management, as I said, eat smart, beat the hormones. Diet chart is very, very important. So a balanced diet helps you to keep your weight check. Check your BMI, whenever you go to gym or any other places where they check the weight, check your fat content in the body. Make sure it is in the green line and build your muscles. Next, coming to the diet, it's a low carb, high protein diet. We call it also Atkin diet. In here, we follow the whole grain meals with fruits, vegetables, avoiding the animal fat, and balanced in case taking about the nuts and vegetables. So lifestyle changes plays an important role in PCOS. So if the young girls are suffering from the PCOS, so we have to advise them on outdoor activities like badminton or tennis so that the weight is under check. Now, coming to the medical line of treatment, it depends on the age at what the PCOS has come and what treatment she wants for the PCOS. If the young girl comes to us, so what we tell them? We tell them mainly for the lifestyle modifications, and mainly we give the medication only to get the withdrawal periods. So irregular cycle is one of the important part of the PCOS. So any young girl comes to us with a irregular cycle, so we may give about the progesterone withdrawal or cyclical combined oral contraceptive pills to get her cycles regularly. If a woman in a middle age, married woman comes to us, depending on her need, either she wants to regularize the cycle or she wants to plan for pregnancy. If she wants to regularize the cycles, we mainly give about the oral contraceptive pills. Along with that, we may add for a metformin for the to come back about the insulin resistance. Or in case if she wants plan for the pregnancy, then we may start with the ovulation inductions with the tablets or injections depending on the condition. In case if she doesn't ovulate with the tablets, then we may go with the surgical way for it to treat the PCOD by laparoscopic ovarian drilling. In case whenever there is a severe male factor involved or any other causes for infertility like bilateral tubal block or severe endometriosis with PCOD, then we may advise for the IVF in these couples. So depending on the need and the stage at what they come, we offer the treatment for the PCOS. In any woman who is already married and have kids, she has a PCOS, then the line of treatment would be the combined oral contraceptive pills, or we may give her a cyclical progesterone to get her periods regularly. So the core treatment for this is the weight management and following the healthy lifestyle. So whenever we do all this, the hormonal imbalance in these conditions gets corrected and we can prevent or check the PCOD and we can have a healthy lifestyle. So in conclusion, so PCOD, so it is a very manageable endocrine disorder. Lifestyle modification is a cornerstone of the treatment. So every woman's health is not a privilege, it's a right. So as I suggest for every woman, along with your physical health, mental health also is important. So many of these diseases have a mental health issues also. So you have to take care of your both physical and mental health. If you have any questions, kindly put forward the questions.
Yes, madam. There are a couple of questions in the message box.
Okay.
Janaki, madam wants to know, when should someone with the irregular periods or PCOS start fertility treatment instead of waiting naturally?
Yeah. So when you're getting married and when you initially plan for the pregnancy, whenever the couple decides for that you want to have your baby, so you can come to us. So whenever you have a irregular periods means what? So if your periods is not happening after 35 days also, we call that as a irregular periods. That time you have to consult your doctor, get checked. So do your blood test and get a scan done. So if the doctor diagnoses your PCOD, then immediately start the treatment.
Yeah. One more question, madam. AMH levels are low
Yeah.
or high. What does this mean for my fertility and chances of natural pregnancy?
Yeah, it depends upon your age now. So if you are young age, still you can try naturally. If you are old age, that is about 35 age, so whenever you see a low AMH, please do not wait. Do not waste your time. Go to your fertility doctor. They will advise you assisted reproduction. It may be initially IUI or IVF, depending on your husband's sperm factor and the tubal patency test. The further things will be done. So whenever you see a low AMH, not to get panic, but you have to take a proper step at the right time.